Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. My assistant is Abzal Kairatullah. And patient number 6 for today. There is a mistake. Case number 5, but it's a case number 6. Okay, let's see this 3D. Let's see this 3D. 3D looks like this. There is small aneurysms before the main aneurysm, and this is a supraclinoid segment. It looks like this, and then it's a paraclinoid, and good PCAs and good PCOM. Yes, good PCAs, both of them in place. That's why I think we can occlude this PCOM segment. As stentasis coiling is better, I think, and we can also coil the orifice of PCA. I think it's the better way to deal with this aneurysm. There are two aneurysms, that's why I prefer to coil and to place Leo plus stent. And this small aneurysm will cure with the with the braided stent. Okay. I'm not sure that we need to protect PCOM. That's why it's a wide neck, and the part on the artery is nearly 6 mm. Okay, the aneurysm size is nearly 8 by 6, and Абзал, what is your opinion? Можно вот это подключить. Наталья, можно вот это подключить. I'm asking Natalia to put the review. Right PCA, right ICA territory is normal. ACOM is in place. There is small aneurysm in cavernous segment. Cavernous segment aneurysm. We will follow this aneurysm. It's not the question of today's treatment. Left vertebral is coming from the aorta. It looks like, yes. It's the same. There is a spasm, I think, and this is the left side. Okay. I prefer to measure on 2D, and on 2D this part is 4.5 millimeters, and this part is 3.6 millimeter, and distal part is nearly 3 millimeters. I think 3.5 by 25 level will be okay. Yes, and Evgeny came, and Natalia stayed from the morning, and Evgeny just came. Okay. Так, нанбрил, гамма брил. Так, ноги рюкзак, на нашес. Yes, I think the Leo stand will be better. We can place Leo first and then can go with the gamma inside. I think it would be better. Okay. We will do classical stent assist coiling, but only question is, we have only small coils. and then we need bigger coils, 8 millimeter. I have 8 millimeter penumbra coils, or we can use Kanika. Kanika is possible, but I think penumbra could be an option. Okay, let's see. We have 8 millimeter penumbra PC 400 coils. Bir Y коннектор бересіз, біреуі бар ғой, жетеді. Все. И біреуін бере салыстан. Так, и не бере салшы. Терезенің алдында PX Slim деген микрокатетер бар, соны бере салшы. Терезенің алдында. Так, гамманы пока жалғамай тұра тұр. Ұзал қайратшы. Гамманы жалғамай тұра тұр. PX Slim жалғаймыз. Так, гамма жете берсін. Так, и бір обычный Xeon Blue бере салшы. Okay. The guiding is 8 French, right coronary, and the PX Slim деген бар. Жоқ ол емес. Дальше. Осы. Yeah, sure. As for the coiling, we use penumbra PX Slim microcatheter. 60 watts деген даш бере салыңыз. And the first coil will be 830 penumbra coils. Penumbra PX Slim. Microcatheter. PX Slim деген.
Нешеттің?
25-тік. Үлкен, мынаны жалғайсың. Жоқ, оған мынаны жалғайсың. Okay, 8 French guiding, coronary. We place through the short cheese, 8 French, and тұраты оны емес, мынаны саласың. Ананы неге васкаға саласың. Васка ашты ғой, да? Я ошибаюсь. И ана жерде васка бар, или екеуінде ашты саласың. As it will be stent assist coiling. The first coil will be penumbra PC 400. Бересің. Ана васканы алып жер. Ашты жер. Ашты жесіңіз. Yes, we will use PC coils with a PX Slim microcatheter, which is 25, the straight one. And the second microcatheter will be Vasco from a box of Vasco Leo plus 3.5 by 25, Vasco 21 plus. And I think it's not the regular 21, I think it's 24 microcatheter, but we need to see. We need to check the box. PX Slim went with the Xeon Blue, and for the Vasco we will do 25-degree J curve, and there is an additional one aneurysm, microaneurysm before the entry. It's very important to keep in mind. Yes, it's better to check the collateral flow before the entry. And ekran cel tartasalşı. Ekran cel tartasalsı. Okay. Let's go with the Moscow. Так, tartasalsı, чуть-чуть. Все пойдет. Ага, рахмет. There's 2 microcatheters. Spiral 2 microcatheters is in place. Now I will do maximum zoom. And then let's change for the link. Where is my mouse? Mouse is not working. I think we need to change the... Женя насраш. Нам батарейкасын Женядан сұрай салшы, тауыстырып бере салсын. Change content. Let's fix lateral. It's not changing. We need to change the battery. Жень, можно попросить батарейку поменять? В мышке. Мышка. Я не знаю, если подойдет. Там, по-моему, маленькие батарейки, да? Все выходит. Одна батарейка. По-моему, не здесь. Все здесь. Спасибо. Заработал. Okay. Now we can change here. We need the left X-ray lateral. It's not change content. Okay. Okay, I couldn't change. I need to do it like this. Okay, I think it's okay. Let's try to do it like this. Okay. As the lateral tube is nearly kaput, that's why it's behaved like this. Stop. Okay. Морой, да, смарт-маск? Смарт-маск морой, да? I need to go up. Okay. It looks like there is not so problematic to go distal territory. Okay. That's good sign. It's not a problem, no? Okay, this is big slim, and this is Vasco. Okay, let's start to place the little plus first, and then we can place the first coil. This is Vasco. Just a second. Гепарин без мобилизации. Yes, I am asking for 5,000 units of heparin. Vasco 21 plus, and now we're pushing Leo plus 3.5 by 25. I think we need to change the angulation. Okay, just a second. I think we need to change this one. Like this. And it's possible to do like this. This is better. To check the distal part, which is 36 left and 25 total. I don't like when my assistant is doing it, but it's Maksat, and it's a school of Astana Neurosurgical Center. Huh? Okay. Now we need an angulation for stent placement. It's not the angulation for the aneurysm coiling. It's just for the stent placement. Okay. Stop. Stop mask. Yes, we can start from MCA. It's a braided stent, and which should be no problem. It's very important to check on the AP. Just a second, I will put the AP here. I need an unsubtracted view when I'm delivering this stent. I think this point is better. The length of the stent could be short, and the landing zone. So I think now it's better. Stent is opened properly, and now we covered both aneurysms. Okay, let's start to place the coil. This is penumbra coil. We asked first for penumbra coils, and then we can switch for gamma, and we can go through the stent to place the gamma. Okay. And now we gel the microcatheter. Yes, it's a gelled microcatheter. And 8mm coil could be a little bit big, but I hope it will fit. Okay. It's an 8 by 30. I think we need to take AP and lateral. I think do something like this. And now I think it's better. With this. Let's take the first loop. Yes, it's 8 by 30, but it could be quite big. It's a one coil. One coil, 8 by 30. Okay, it's leaking. Need to close this. Oh, it's okay. It's much more better. Next coil we can take 4 millimeter. Yes, it's just pulling. Yeah? There is no need for any kind of machine and electricity. Penumbra 8 симайтын шығар, наверное, да? 8 симайды. 4-10 ашып бересіңіз. Алдымен 4-10 ашасыз, возможно 4-8. Екеуін де аласыңыз. Yes, the first one was soft coil. And now we will open extra soft. Тоже пока брю наш extra soft 4x10. 31. Yes, in the United States everything is big, even the micro coils. 25 system, eh? Okay, it has. Just the micro catheter is too big, eh? Okay. And its assistant should be very careful. If you broke the coil in any point, it may detach. That's why the assistant should be very experienced, and then you are in comfortable condition. I think yes, there is a small place, but the next coil is 4x8, but I think there is no place for the next coil. Eh? This looks like we coiled nearly everything. Eh? There's no way detaching. Picon is present. Okay, let's try to place one more 4mm penumbra coil. 36 bells. The one more point, these coils we could not cut. There are only type of coil which is not cuttable. It's a penumbra coils. The design of the coil, it's solid, and it's not possible to cut them. It's only coil. Okay, 4x8. I hope there is a place for 4x8, but maybe this is extra. Let's see. Let's see what we can do with this coil. Okay. Ближе. Оно, видимо, просто маркер. Okay, the microcatheter is now just at the orifice. There is some place in the neck region. Usually it's extra, huh? It looks like it's an extra coil. It looks like there is a place, but I think better not to place this coil, huh? I think we are placing it at the... okay. Maybe better to place the gamma and if it's needed to place a couple of coils. No. Yes, I think it's an extra big coil, and now I will take gamma, and with gamma we can place a couple of small coils. It's a problem when you use 25 system microcatheter and then it's not possible to play the small coils, huh? You could insert only big one. Okay, let's place. Анан PX-лимди аргара аласыз. PX-лимди аргара аласыз. Үлкен микрокатетер. Екінші стол аласыз. And the Y connector is leaking. It's not good. Yes, and the stent is not finally open, that's why we can navigate inside the artery. And we need to keep in mind there is this one more small aneurysm. Okay, now I will retrieve my stent a little bit to navigate the microcatheter inside. Then we can place again the stent. Now we can play with stent and replace it a little bit proximal, and as it's pushed. Okay, the stent is pushing. The coil is big and the patient is moving. Patient is moving, yeah.
Пациент позвал Виктор.
And I think at this point we can finish the case, huh?
Yes.
Because the aneurysm is not anymore filling with contrast. As Leo is in place. Okay, let's check. Maybe it's enough. two coils, two big coils, and patient is moving. I think aneurysm is occluded, and we'll ask for one more Штялте, microplex. Штялте microplex. Ошиблись. Okay, let's place 3/6. Назад полежишь, спряжер. Минус. Стоп. Ага. Ну, хорошо. Yes, and it's not possible to push through the 25th PX Slim microcatheter 10 system coils. That's why if you plan to place additional coils, smaller coils, then you need a second microcatheter. Sara Dilex'inde nakoyuyorsunuz. Okay, let's place the map. It's not so comfortable, but okay, let's see. This is the first marker. This was the first marker. Осторожно. Yes, it's under the stand and stand. Okay, let's take it out. This microcatheter is somewhere there. And now we're placing the coil inside the stent. Huh? Okay. It's better to finish before the complication, huh?
Yes.
And coil is stretched. Yes, and if the coil will recanalize, then we can place one more stent, no problem. The part of the aneurysm is still filling, but I think it's okay. It will be occluded, no problem. Sometimes the balloon assistance as a first step is better. Then it's possible to densely park the aneurysm. Huh? Yes. That's why, if it's possible, the balloon assist coiling is better. Yes, the aneurysm is occluded, partial filling, it will thrombose, and stent is in place, and I hope it will be occluded. There's a lot of place. As the better option to place the first small microcatheter, then bigger microcatheter, then coil with both of them. And the option number 2, we can go with the microcatheter and go till the point of filling, but I think it's a little bit complex, and at this point I prefer to stop. The aneurysm is coiled, then it will be thrombosed, and I hope the nature will help to heal this artery. Okay, we can do control MR in a couple of months, and then in 3 months we will ask to come for the control angiography to check the stent, and there is a small aneurysm at the entry point. Okay, if it's needed we can place one more stent later on. Yes. Вперед, вперед. Назад. Стоп. Вперед. Стоп. Назад. Окей. Назад. Стоп. Вперед. Just a second. Let's compare. Let's compare it. Let's look like this. Let's look like this. Huh? Look like this. That's the shape of the aneurysm. Huh? Okay, this same shape. And it's an artery surrounding. Okay, I think we start coiling. We started stenting in the time of stent placement. This is the first coil and first stent. 2:25, I think it was 13 minutes, huh? It's nearly 13 minutes left, and 10 minutes, huh? 10, no, 13, nearly 15 minutes. That's okay. The stent is okay, the aneurysm is okay, and now I think we can finish, and I will ask Abzal to do control expertity. Екайдан кейін аматқа, шайдан кейін ангиография. Okay, let's wait for control. Келесі пациент шақыра. We have one more patient, but I think there is an infundibulum in this patient. Let's see. Yeah? Dear colleagues, this CT is ready. This is a coil mass and stent. Everything is clear. Now we can finish this case and see you in next 20 minutes. Next case, picoaneurysm, but it might be infundibulum. Let's see. See you.